Hi, Cam followers. This is the amazing Sarah Heath, who's a really dear friend of mine. Sarah, please tell the Cam followers a little bit about yourself so they are as impressed with you as I am.
Wow, that's a bit difficult. I'm not feeling very impressive actually, because I'm in self-isolation at the moment, as many of us are, and it's all feeling slightly weird. So my name's Sarah, and I'm a vet, and those are the most important bits. But I'm a specialist in veterinary behavioural medicine. So basically, that means that I'm a member of the European College of Animal Welfare and Behavioural Medicine, and an RCVS specialist, and a fellow of the College of Veterinary Surgeons in recognition of work done in behavioural medicine. So behavioural medicine is my life, really. I've got a couple of other letters after my name which are related to teaching. So I've got a postgraduate certificate in veterinary education, a fellow of the Higher Education Authority, Academy, which is basically just because teaching is the other part of my life. So most important thing is I'm a vet. Second thing is it's behavioural medicine is my thing, and then teaching.
Tell the people what the difference between behavioural medicine and a behaviourist that they might find.
Yeah. Okay. So a behaviourist doesn't have to be a vet. So we have lots of people who work doing really, really important work in clinical animal behaviour who are not vets. People working in behavioural medicine are vets, and the difference there is that what we do is we work on the internal medicine aspects of behaviour. Mm-hmm. So how I put it when I'm explaining it to the profession, because the profession sometimes needs it explained, is that those people working in my field look at the triad of health. So it's three aspects to it, obviously the triad. So you have physical health, which is the bit that obviously every vet is very concerned with, and it's the majority of the veterinary undergraduate curriculum is focusing on physical health. But we also have two other components, which are cognitive health, which is the way you learn things, the way you think about things and process things. That's also a part of your health, as it is for non-human animals. And then the third part of the triad is emotional health. So the way that non-human animals feel about things and how their emotional systems drive not only their behaviour, but also affects their physical health. So that triad is inextricably linked. So basically, working in behavioural medicine, I work in looking at how cognitive, emotional and physical health interplay with each other, and look at how we can modify emotional health and change cognition with the benefit of not only improving those parts of the health triad, but also beneficially affecting physical health as well.
Which is something that we have is so inbuilt into the way we understand human health now, about stress and stress impacts on physical health. But it's something that is still a little bit behind the times with animal health, isn't it?
Yeah, I wouldn't be too encouraged as to how good it is in human health, actually. Humans do at least acknowledge there is a link between your emotions and your physical health, but I don't think it's very well understood. And I think people still dismiss emotional health in human animals when people have skin disease and gut disease and urinary disease. And I think there's still quite a resistance to actually looking at the link with emotional health and cognitive health. But yeah, in the veterinary field, we are probably even less advanced than the human medics. But as I say, I wouldn't get too excited about how far the human medics have come on this. We're all hopefully better at acknowledging that emotional health is very important, whether you're a human animal or whether you're a non-human animal. And that ability to link these three aspects of the health triad together, I think, is something that, yes, is getting better, but is something we all need to be working really hard on. Try and appreciate that you can't treat physical health in isolation of emotional health. It's not possible to do that. And if you have a physical health issue, it's really important to always consider whether there's an emotional and cognitive component to it. But the other side of that coin is if you have a behavioural change have you considered a physical health reason for that?
Yeah.
That is really important. It works both ways, that having a physical health condition, we must always consider emotional and cognitive health as components of that. But equally, when there is a behavioural change, we must remember that there can be a physical health component to that behavioural change. And that's why it is behavioural medicine, why it's a veterinary discipline. And also why, if an animal presents with behavioural change, you may well go and see a non-veterinary behaviourist, and that is perfectly acceptable, not only acceptable, advisable, if you have behavioural change, to seek help from people who are working as clinical animal behaviourists. You should look for someone who's certified by the Association for the Study of Animal Behaviour and has clinical CCAB, certified clinical animal behaviourist, or someone who's a member of the FABC, the Fellowship of Animal Behaviour Clinicians. These are ways in which you can make sure you're getting someone reputable. But what's also important is to remember they should be working, and if they're reputable, they will be working on veterinary referral. And the important thing about that is you must go through the veterinary channel first to make sure we have someone who can look out for physical disease. They may not actually find the physical disease immediately, so you may go and see a general practitioner about it, and chronic pain is a classic for this, cannot be diagnosed in a veterinary consulting room. And so if you go see a general practitioner to be referred to a certified clinical animal behaviourist, as we recommend, then you need to remember that that's the beginning of a dynamic relationship between your clinical animal behaviourist and your veterinary surgeon, because it may be that you then go to see your ASAB CCAB behaviourist, and that they then do all of the investigation, look at the behaviour and say, I still think there could be something physical here, and they go back to the vet. And that's really important. It's not like a referral is not like just ask your vet to write a letter and that's low involvement. It's a dynamic relationship between the clinical animal behaviourist and the veterinary surgeon going forward.
I think that's something that is needed to be clarified with a lot of the interdisciplinary, the multidisciplinary team, be it with the physio, be it the hydro, be it the chiropractor, be it the acupuncturist, be it the behaviourist. There needs to be a very good working relationship and a respect of each other's input.
Absolutely.
And
absolutely. And both those sides in that CCAB veterinary surgeon relationship are equally important. And that's really important. And obviously your vet may refer you to a veterinary behaviourist like ourselves and our practice. And then of course, we can do the physical, emotional and cognitive health, all of it within one premises. But we still have our rehab team are people who are not vets, doing either physiotherapy, so rehab as in that sense, or doing behavioural rehab within the practice. So absolutely, this is something that is hugely multidisciplinary, many levels, and the most important thing is mutual respect.
I love it. And what we'll do is we'll put some links to what you were just suggesting, so people can find what they need to find. So let's crack on. Sorry that I look like I'm in some kind of like prison cell with shadows.
I'm just feeling like, whoa, my hair on the picture behind.
I think it's because there's so little broadband now. We're all hiding in like top rooms of trying to get signal and stuff.
It's also, I was realising I'm normally in my office to do these things, but I'm isolated at home at the moment. So I was just looking in the background and going, oh, there's pictures of my children. So
I'm isolated as well, and I'm just hotspotting off my phone. So sorry guys if this is a little bit less, not the quality you normally expect. Anyway, right, let's crack on, because we've got a few questions coming in already, but what we'll do is start the conversation and we'll come back to them. But first, the topic tonight is a two-way street: pain and related behaviour, or associated behaviour, and then behaviour because of pain. And this is something that's really important to me, because I have so many conversations with owners about why the dog is continuing to do something even if it hurts. I want to go there. So it's going to miss
definitely.
that section. But let's start with the more appropriate, which is pain-related behaviour or pain-exacerbated behaviour. Go for it. Have a chat. Tell us.
Okay, so this is really important because I think a lot of people think that if an animal is in pain, it will be aggressive. Now, anyone who's ever heard me speak before will know that I hate the word aggression because it means absolutely nothing and has to be defined before you can use it. So I very, very rarely use that word. But certainly people do assume that if an animal is in pain, its behaviour will be confrontational, will be hostile, will be offensive. And that sadly is not the case, because when we look at pain and chronic pain, we have to remember is a disease. It's never normal. It's always pathological. Acute pain, on the other hand, is a functional response to pain in an acute form and does have a function of protection. So that's a completely different thing. So I'm going to concentrate tonight on chronic pain rather than acute pain. So acute pain would be things like surgical pain or things like a wound or things like, you just stepped on something and hurt your toe or whatever. What we're talking about is chronic pain. So in the cases of your arthritic patients, as PAMS obviously represents, then you're talking about chronic pain. And there are many, many other forms of chronic pain, not just arthritis, of course. I mean, I don't want to, we're not considering those. We're just focusing on the arthritic patient. So in a situation where you have chronic pain associated with arthritis, there's still this assumption that the animal will be hostile and show behaviours which are confrontational and that people might refer to using that word aggression. When we look at why that's not the case, we need to remember that pain is not only a physical sensation, so both what we call a motor and sensory response, so that there's a sensation and then the body reacts to it in some way, but it's also a cognitive and an emotional response as well. So this is a condition that affects every aspect of the health triad. It affects your physical, your emotional, and your cognitive health. When we look at the emotional component, pain as an emotion is what we call a negative emotion. Now, that doesn't mean it's bad. So negative and positive, when we're talking about emotions, does not mean good and bad. Positive means an emotion that drives you to engage with something or someone. Negative is an emotion that drives you to protect yourself from something or someone. So pain is a protective emotion. It's a negative emotion, but not necessarily bad. And therefore, when we're looking at how an animal might respond when it's in pain, we need to know how animals react to negative emotion. What are their strategies behaviourally for dealing with being in a negative emotional state? And those behaviours are all about, how do I protect myself? So negative emotions lead you to protect yourself. And in order to protect yourself, there are different behavioural responses you can use. And not all of them are confrontational or so-called aggression. So let's look at pain, which is a subset of the fear-anxiety system. So I don't know if any of any people listening tonight, I know Hannah is familiar with the Panksepp systems. But if any of you who are not, Jack Panksepp was an Estonian biologist who made a massive contribution to the understanding of emotional health in both humans and non-human animals. And what he identifies he identifies 7 different systems, 4 of those being positive systems or engaging systems, and he identifies 3 negative systems, but a subset of fear anxiety is pain. So we often talk about that being 4 systems, but pain is actually a form of fear anxiety. It's a form of negative emotion to protect yourself, in the case of pain, from physical harm. Okay. So when an animal, it doesn't matter if it's a human animal or a non-human animal, when they are responding to pain and they are going into these potentially protective behavioural responses, we've got 4 different types of behaviour they can select. And the one everybody thinks about is what we call repulsion. And the terminology I'm using is from a model or concept, the SYNC concept, which I developed in 2010. So this is the terminology from that particular concept. So in that concept, I use the terminology of repulsion and not the terminology of fight. You may have heard of fight and flight and freeze. That terminology is valid and can be used in different contexts. In my model, I don't use that terminology, and the reason is that fight for me is too limiting as a description of how these animals respond, because they don't always necessarily physically fight. You can show repulsion. So the reason I chose that word when I developed this model is that repulsion means the aim of the behavior. Hello, Luna. The aim of the behavior is to increase the
Go away. 2 seconds. I'm back. I'm mugged by the dog.
Increase the distance and decrease the interaction with whatever it is that's worrying you. So if you repel something through your behavior, whatever it is that's worrying you becomes more distant from you and doesn't interact with you as much. Now, that repulsion may take the form of a physical fight, but it could be as anything from a curled lip to a grumble to a growl to a snap in the air. It could be so many. It's a spectrum of behavior. Okay. And that spectrum of behavior will depend on so many different factors as to which of those behaviors you select. So that's the most obvious one, repulsion. That's what I think most people expect. Dogs in pain, it will show what people sometimes call aggression, what I would call repulsion. So that's one of them. But there are other ways of dealing with this negative emotion. And one of them is to make sure that you increase distance and decrease interaction. So the same aim, but you do it by you taking the action. We call that avoidance. And again, I don't call it flight because it doesn't always involve physical movement. It involves increasing distance, decreasing interaction through your activity of doing those 2 things. And therefore, I call it avoidance because, again, it's a spectrum. You may have heard, people may have heard people talk about the ladder of aggression. That's not what I'm talking about here. What we're talking about are independent behavioral responses of repulsion and avoidance, each of which has a spectrum within it. And I think that's quite important because you can also have both of those responses happening at the same time. They're not mutually exclusive. They're not on one ladder. They are independent behavioral responses, each of which has gradations of intensity, but you can switch between them. You can use them together. And they're not the only ones. So they're the most obvious ones, avoidance and repulsion. But there are 2 more. And those other 2 are used not to increase distance and decrease interaction, but to increase information about the thing that's worrying you. And in socially obligate mammals, so that's dogs, horses, people, those information gathering techniques are actually sometimes preferable to avoidance and repulsion, because when you avoid something or repel it, you lose any potential benefit as well as losing the threat. So if it's a social thing that's worrying you, so if somebody is coming towards you and you're in pain, but you're a socially obligate mammal, then actually that person could also give you benefit. And if you use repulsion or avoidance, you're not going to potentially get benefit either. You're going to lose everything. Yes, you'll have less threat, but you'll also have no potential benefit of social contact. So in that situation, instead of repelling or avoiding the thing or whatever it is that's worrying you, you either passively gather information about it, or you actively gather information about it. So let's look at passive first. So passive gathering of information we call inhibition. And again, you may have heard the term freeze. I don't use that term because, again, this is a spectrum. Inhibition is a spectrum of behaviour. It's not just physical stillness. It's any situation where an animal is using sensory input. So it's looking, it's listening, it's sniffing or taking in olfactory information, but it's not giving any information out. It's a one-way street of just taking information in. And we see that so often in the consulting room. And I said earlier, you cannot diagnose chronic pain in the consulting room. And one of the main reasons for that is that many animals in the consulting room will go into inhibition because it's a highly social environment. There are people around, but they often cannot use avoidance because the door is shut and they are on a lead or they're on the table or whatever. They don't use repulsion because they would lose all social contact, and that's not helpful for them. So they go into inhibition, which means that when you manipulate an animal in inhibition, so say you try to move its leg, it will not show a response. It will just sit there. And then go, oh, there's no pain. I manipulated his hip. I moved his leg. There was no pain. But if you're in a state of inhibition, there won't be any obvious, overt, physical sign of pain in that context. So we need to be really careful that we don't miss those individuals. Then the final one is the active gathering of information, which is appeasement. And that is where, yes, you take information in. So you watch and you see, watch and you listen and you smell and etc. But you also give information out at the same time. And animals like, let's take dogs, they give information out and receive information in ways that we sometimes misinterpret because they look like what we would use as affectionate behaviours. So when a dog is appeasing, they will try and gather that information in and give information out using their olfactory, their tactile, their auditory, their visual stimulation, their system. So what does that mean? It means that they might lean into you, tactile way of gathering information and giving information. They might sniff at you. They may sniff and then lick because the scent that they're used to getting from other dogs is produced from little glands right under the skin. And to get those glands to work, they lick that skin. So when they are sniffing at humans and there's no scent forthcoming, they lick to gather more information. So we've got a dog that when you examine it in the consulting room, as you're manipulating its leg, it starts leaning closer into you or licking at you or trying to engage with you. People go, well, can't be in pain. He wants to be my friend. And so these dogs that are either inhibited or appeasing when they are in a state of pain are often misinterpreted as not being painful, when actually they are just as painful as the dog that snaps in your face or the dog that's running out the door. Well, not running if it's got arthritis, but hobbling out the door. So these 4 ways of responding to negative emotion, which includes pain, are incredibly important to be seen as equally significant. And that's, I think, our main challenge in recognising that dogs are suffering from chronic pain.
So let's take the situation of the consult a little bit further, and let's turn this into something useful, because I can remember when I first heard you lecture about this topic, I just myself felt kind of mentally inhibited. I was like, I don't know what to do now. I just feel useless. You know, I'm a first opinion practitioner. I want the animals in my care to get the attention that they need. How can I now do this? Because you've just told me that everything I see and witness could be wrong. So what do you advise owners who have dogs that they're concerned there's something else going on because there's been a behavioural change, a postural change, a physical change, whatever it might be, and they want to go to the vet, but they are worried that the vet isn't going to get the information that they need? What do you advise?
The first thing I would say is take video footage of your dog at home, preferably when it's moving in an elevated plane, so whether that's going upstairs or jumping into the car or going downstairs, anything where the movement is likely to exaggerate the signs that they are physically compromised, which is something, again, that your GP vet cannot see in the consulting room. Take them for a walk, and if the thing that's concerning you is things like bunny hopping when they run on a walk, so that means that both of the back legs move together like a hop, then video that. And when you go into your consult with your veterinary surgeon, say, I've brought some video footage of the things that are happening at home, because I know that this is probably not an easy environment for you to see these changes. And also know that sometimes my dog just goes into inhibition when he comes in here. He doesn't do anything, and that's not helpful to you. So I think a good GP will actually ask you for that video footage. So if you haven't taken it in, then the vet should actually say to you, I can't diagnose this in the consulting room without extra information, so please can you take this video? But if you're a well-informed client with someone who's a member of CAMS and you've heard all this stuff, then help your vet by taking that information with you at the consult. The other thing is that it is useful to do a clinical examination. Of course it is, because if there's crepitus in the joint, then, which is basically as you move the joint, there's a sensation, a feeling within the joint. We know that there's something wrong. There are things that we can tell physically. So, of course, I'm not saying don't go to your vet. You must go to your veterinary surgeon to have this discussion. But remember, that first consult might not be the point at which you make the decision. It may be the beginning of the process rather than the end of the process.
And I think that's something that we come back to in many Facebook Lives, is managing people's expectation. And there's a tendency for people to see arthritis and chronic pain as simple and a one-way street, and it's just going to be this plus this equals this, and it really isn't. So I think one of the things that CAM hopes to do is to promote these conditions to have more attention, and if that means repeated consults until you get to the right, optimal point, great. I think for people that don't have good IT skills and they're still struggling with the smartphone, then even just listing what you're seeing and the array of changes that you're seeing and being able to describe them. Because I know what happens is people come into my consult room and suddenly everything leaves their head. And they just say, he's just not right. And you're like,
Just the situation. And I think absolutely, I echo what you just said there, Hannah, that if they can write a list, every time you see something your dog does that causes you concern, write it down. Absolutely. If you are tech savvy and you can video it, brilliant. And do think about pain investigation being something that doesn't happen in a 10-minute consult. That is the beginning of the process. And one of the things that we are really urging the veterinary profession to do, a new paper has just been published just before I went away, actually, so it's probably about 3 weeks now, that in Animals, which is a journal called Animals, a paper by Daniel Mills and colleagues, which is absolutely amazingly brilliant piece of literature, which is now showing the link between pain and behaviour. And the fact that the link is not always direct and not always obvious, that it is very subtle. And I would urge, ask your vets, have you read that paper? So I know a paper's been published in Animals very recently by Daniel Mills and his team at Lincoln University. Do you have a copy of it? Could you get a copy of it?
I'll put a link. It's free access.
It is free access.
I'll put a link underneath, guys. I will warn you, you need to read it about 2 or 3 times because your brain gets skewed at the 4 different ways that pain and behaviour. And It's quite complex.
It's very complex. But
it's amazing.
Encourage ask your GP to read it if they haven't read it, your vet GP, that is. And the other thing is that as is emphasised very much by myself and Daniel and all our colleagues, is that pain relief trials are really important. That it is okay to put animals on pain relief for a trial of at least a month. It's not okay to use pain for 5 days. You need to use it for at least a month, and usually more. So usually we're talking between 4 and 8 weeks of using pain relief and then monitoring the behavioural change during that time.
Yeah. Okay.
And that is actually probably more helpful than doing imaging. And I agree. Want to have an X-ray. Yeah, they want to take X-ray. Now with arthritis,
but that's a very human thing, because we're very visual species.
Yeah.
And we that's why, you know, we like to do an X-lap and get in there and have a look and
look at it. Yeah.
Going on. Yeah.
Yeah.
So we've got a couple of questions now. Don't worry, Sarah. We will get to hyperactivity, behavioural issues, and pain. And don't worry, Julie. We are going to talk about anxiety and the difference between, you know, is it pain or is it anxiety? But let's just take our behavioural responses and now take it into the sort of things that you commonly see that people come to you with. So before we do pain and behaviour making pain worse, let's go and just talk about those cases that come in and how you can relate this behavioural response understanding into the regular common presentations that you see. Does that make sense?
Yeah, I think so. So, I mean, obviously the most obvious ones are where there is some kind of hostile or confrontational behaviour. So where you have an animal who is using repulsion. Repulsion is not the only form of hostile behaviour. There's also something called confrontational behaviour, which is not repulsion. So by not repulsion, we mean the aim is not to increase distance and decrease interaction. That comes from an emotional state called frustration. And frustration may be involved in some pain cases, but I think to keep things a bit more simple tonight, we'll stick with the repulsion situation from pain. But so yes, there may be that the presentation is repelling. So the animal has snapped at someone or growled at someone or been less amenable to being handled. Maybe that there's an avoidance response. I think those ones are much easier. So that the animal that moves out of the, moves away when someone walks towards them, or turns their head away, doesn't want to interact with them, or someone that a dog that doesn't want to go into the car, avoids getting up into the car, or avoids going upstairs, or avoids jumping onto the sofa, or maybe temporarily shows avoidance. So what the owner interprets as being, caregiver interprets as being hesitant behaviour. So if he does still get on the sofa, he does still get in the car, well, yeah, he does hesitate a bit before he gets in. That could be avoidance, which then is overcome because of, which I know we're going to talk about in a minute, but because of the fact that all emotional systems are potentially firing at any point in time. And the outcome, here's Louis, who'd like to say, hello, Louis. So the other, all those systems are in balance with each other, and your output of behaviour is always the result of your predominant emotional state at any point in time.
Yeah.
So obviously that system of pain may be predominant and cause a hesitation, but if desire seeking, which is to get in the car and go for a walk, so the desire seeking motivation to engage with the car because it takes you to your walk, then becomes predominant, then the dog will jump in.
Yeah.
And so you see this change in behaviour. We're going to talk about that again in a minute. I know that was something you mentioned, Hannah. So it can be quite a transient response to the pain, and then the animal can carry on and actually overcome that pain because another emotional system becomes predominant at that moment.
Yeah.
This is incredibly dynamic. These emotions are not set in stone. They don't stay exactly in the same relative proportion to each other over time. It changes according to context. It changes according to relative motivation, etc.
I think a really good point from there, because I know like I'm learning to keep up with you, so I'm not a behaviourist. And the more I hang out with you, I'm sponging off you. I just absorb stuff. But I have to really listen to keep up. So,
and that happens the other way, guys. Actually, anyone who's listening, that I sponge for arthritic information from Hannah as well. So it's a complete two-way street here.
Well, just because I want to make sure that people don't feel that they're getting lost. I love the fact that you've talked about hesitation, and I think it's hugely overlooked. So a classic thing for me will be when an owner notices that their dog seems maybe a bit less obedient, not fulfilling their wishes as quickly. And it'll either be lumped into they've become a bit disobedient, or they're getting old, or they're slowing down. But that hesitation, as you say, could be a really big key indicator that
absolutely
they're avoiding something.
Yeah, it's an avoidance response. It's momentary sometimes, and that's why it can get missed. And as you say, so easily misinterpreted as stubborn, or oh, he's going a bit deaf, he probably didn't hear me, or whatever. So remembering that some of these animals we're dealing with, not all, and I'm sure we'll touch on that as well, arthritis is not a disease of old animals only. But if it's in an elderly animal, as it often is, it can so easily be misinterpreted as, oh, he's going a bit deaf, or he's a bit stubborn, or he's a bit grumpy, or all those sorts of things that we kind of associate with being old. And it's really important to open our minds up to other options for explaining those behaviours. So that we don't.
I think a general rule that I have, and it's so simple in my head, is dogs are amazing. They're amazing, and they're such good companions. And, you know, if there is something that is causing that break in that relationship or that potential bond, then just look into it, you know. And I really have that as a baseline. You know, if something has changed, if something isn't right, then look into it, because then
the other thing, I think, I'm sure many people listening tonight will be your followers and will have seen your fantastic video on No One Should Suffer in Silence. If you've watched that video and you've seen that absolutely brilliant parallel between a non-verbal human animal and obviously Holly, bless her, in that people assume that because you can't verbalize, you can't communicate. Obviously, that is just not true. Verbal communication is something that as humans we are so reliant on that we have lost our skills very much to see visual signaling and to see signaling that comes from other sources other than vocal. So I think that video was brilliant in that it made people just think, here's Lewis, made people just think about the fact that, you know, yes, maybe it's not overtly, blatantly obvious the minute you walk into the consult room, and that man walked into a consult room as in a non-verbal human form is exactly the same as a patient walking into our consulting room. And just because they're not walking in and verbalizing does not mean they haven't got something to say.
No.
And it doesn't mean they're not saying anything. I get so often people saying to me, oh, you're a vet, that must be so difficult because your patients can't tell you how they are. And I go, no, they do. They do. They tell us exactly. They just tell us differently.
Yeah.
And it's learning as humans to expand our ability to recognize non-verbal signaling, just as that doctor in that amazing video had to do. Yeah. And it wasn't until that man made certain movements that she actually went, oh, actually, there is information there. He hasn't said a word, and he starts off by being quite confrontational, almost as, well, if you don't tell me, I can't help you. Yeah. And then she realized, actually, you are telling me.
Yeah, no, absolutely. No, it's a very good video because Holly was in.
Fantastic video, and yeah, if you haven't seen it, you must.
Yeah, I'll put a link to that as well. So let's go back to these presentations so that we can help Sarah out. So Her actual question here is, I read somewhere about a link to dogs with hip and joint issues having a link with hyperactivity and behavioural issues. So let's go back to this. We've got an owner that thinks something's up, and they're wanting to take it to the vet. We've had hesitation and avoidance and maybe some repulsive type behaviours or hostility on walks. But what about these dogs that don't show those signs, but they show behaviours that aren't quite right?
Yeah. Hyperactivity is an interesting word, and we could probably spend an hour talking about that. But if I'm right, Sarah, in what you're meaning as arousal, so having an animal that's more aroused, that's more active, more interactive, that may be because what you're seeing is appeasement. So this animal is actively seeking information from you. So these animals are often quite social. That they're persistent, that they want to interact, they want to be there doing stuff with you. One of the reasons why that happens to say is because they're gathering information. The other thing to remember is what we were talking about before, that it depends on the individual animal and their emotional motivational bias. So all of these emotional systems, and we haven't got time in a 1 hour thing tonight, we perhaps we should do another one on concept systems sometime. But yes, the systems are all present, and it does really depend on the relative motivations of those systems as to what you see. Let me give you an example of a dog called Gemma. Gemma was a border collie I saw many years ago, and she, bless her, she was presented to me actually for circling, for shadow chasing. So she was turning round and round and round in circles. And she was doing this at particular times, which was mainly in the evening when she'd been resting and the family had been watching the telly, and she lived with another border collie who was not a sibling, it was about 2 years younger than her. And they lived in this household, and in the evening, the two dogs would lie in the lounge with the owners very quietly and very well behaved. And then the family would get up to go to bed. And when they got up and Gemma got up, she would start to go to this circling. The other time she would do it is first thing in the morning. So when they came down in the morning, she'd been in her bed overnight. And when she got out and came to greet them, she'd go into this circling behaviour. So there was very distinct patterns of when she would do this. But what really confused the owners was the caregivers. Sorry, I'm very old. And I know that it's not right to call people owners anymore. And I absolutely believe that. But my brain has been using the word owners for 30 years. And I find it so hard that I do say it, and every time I say it, I hear it and go, "That's the wrong word." But so when I'm writing, I'm really careful. I check things, and I don't use the word owner. But when I'm speaking, it slips out.
We'll let you off. You're fine.
Correcting myself. But yes, so when the client was talking to me about Gemma and about her behaviour, I saw her in the consult. I noticed something not quite right about her movement, but that not quite right about her movement was incredibly subtle, and it was really subtle. Remember, I spend hours watching either live animals moving or videos of animals moving. And so I was watching her, and I plotted her up, and she bunny hopped, really, really brief transitory bunny hop as she went from a walk to a trot. So as she went between different speeds, she gave this little bunny hop. So I said to the caregiver, I think we should investigate pain. And she said, "You are kidding me." She's like, "No, it's not pain." And she said, I take these dogs for a walk every single morning and evening on rough, open farmland. I throw frisbees for them. And these dogs run like the clappers over uneven farmland and leap and chase their frisbee. And under no circumstances can Gemma be in pain, because she does that every day, twice a day, never hesitates. We took the x-rays, and she actually had a congenital abnormality in her spine. And she was in pain, and she needed surgery, and etc. Why does she run across the field after that frisbee? Why? Because she has motivation from her positive emotional systems, which are her engaging systems. Two, one is object play, which is desire seeking, which is strongly motivated in a collie, and therefore her motivation to follow that frisbee was massive. And then social play, because she really enjoyed interacting with her housemate. And so when the two of them were on in the field together, there was an abundance of positive emotional motivation for both of them. Gemma, that positive emotional motivation far exceeded the negative emotional motivation of pain, which was occurring, was happening, but was overridden by the desire seeking and the social play motivation. So on the face of it, not in a month of Sundays anyone had thought that dog was in pain. And yet,
we see this a lot. And I think anybody that has been following Cam for a year or so, when we did an article about ball throwing and ball chuckers and how...
I know how much you love those, Hannah.
Oh, I love them. And we got into the newspaper about it, and we got hate mail. We actually got hate mail.
I'm sure.
And I think people can now realise why I break a little bit. I hurt inside when I see it, because as you say, if you're looking at these dogs in the park, you're seeing them chasing the ball, but you're so used to looking at posture and movement, you're going, no, that's really bad. But they'll keep going and they'll keep going and they'll keep going until... Explain what happens when they don't keep going. So you often will see these dogs and the owners will come in and say, yeah, he used to love chasing the ball, but the other day he was, going great guns and then he just stopped, or things like that. What happens then?
Well, at that point, the pain motivation is winning, basically. The pain motivation has become so extreme that it's overriding those other systems.
And can it happen quickly?
It can happen quickly, absolutely. And the other thing, though, to remember is that sometimes it's not that the ball chasing stops that causes us to realise that it's pain. It's that the other responses to pain start to surface. So they're still chasing the ball in the park, but they're now snapping at people. Or they're still chasing the ball in the park, as Gemma was with her frisbee, but they're circling and shadow chasing and showing compulsive behavioural responses. And one of the things I would really, really urge you to always remember is that compulsion, so repetitive behaviour that no longer has a function, is one of my absolute red flags for chronic pain.
Brilliant. I'm going to put that all over here, because
it's not the only reason for them. You can get compulsive behaviours for a number of reasons. I don't want anybody to say, oh, if they've got compulsive behaviour, they're definitely in pain. That's not true. But it's a massive red flag. And I would always, when I see an animal who is compulsive, whether it's fence running, or whether it's tail chasing, or whether it's fly catching, or whether it's shadow chasing or light staring,
squirrel chasing, bird chasing,
any of those that are become compulsive, my first thing I want to do is rule out pain. Because compulsive behaviours help the animal to compensate for the pain, and they become repetitive because they're self-help, basically.
Why is that? So for owners that are watching this and they're beginning to get on board with this, they're like, okay, I'm beginning to get on board. Let's just try and finish the picture. What happens in these compulsive behaviours? What's happening within the brain? That
changes in endorphin release when you engage in repetitive behaviours. So we don't know it. We don't absolutely understand the mechanisms involved yet, but I think there's a feeling that there is some level of self-help through it. So by engaging in the behaviour that's repetitive, you can release endorphins and you can get some level of pain relief from that. And it may also be that there's a kind of a sticking in the neurological transmission, which causes the behaviour to just keep repeating. So it is complex. It's hugely complex. And there are lots of potential neurochemical and neurological components to it. But I think what's important is to remember that whenever an animal is doing something that's repetitive, rule it out as a potential. I have a German Shepherd dog, bless him, who was presented to me after 2 years. He was 2 years old when I saw him, and he had been chasing his tail and mutilating his tail. And thankfully, the practice that he was going to do refer to us regularly, and therefore they referred to us, instead of amputating his tail, because he had a painful lesion, his caudal spine, which we did find after he'd been presented with the behavioural change. And it's not that pain was the only factor for him. He had severe anxiety for a number of reasons related to his upbringing and his early life, etc. So it wasn't just the pain, but the pain was a hugely important factor in actually leading to this compulsive component. And he didn't need to have his tail amputated, thankfully, because we were able to resolve the anxiety and the pain and then start to work with him on dealing with the more anxiety-related aspects of his behaviour.
Yeah.
But, yeah, these are the thoughts.
And I think that's I'm definitely going to put that paper on here, because it very clearly explains the relationships, and people will always think that it's going to be pain equals behavior change, but it really might not be. Pain might add to the behavior change, or make it more complicated.
Yeah, absolutely. Many times that's the case. It's not a direct correlation. And therefore, what is so important is that we have a range of analgesic medications at our disposal as a veterinary profession. We know that the management of chronic pain is difficult and complex. So you also, please don't think that when your veterinary surgeon puts your animal on a non-steroidal anti-inflammatory, which is the first drug of choice, that's the end of the story, because multimodal analgesia, as in taking drugs from different classes and using them together, is always going to give better pain relief. And so the beginning of the process is a non-steroidal, but that is not the end of the process. It's not the answer in itself. And majority by far of these chronic pain patients will need to have more than just a non-steroidal. Yeah. They will need other medications alongside that work synergistically. That means they work to enhance the benefit of each other in order to give good, comprehensive pain relief. So my two things about medication is the first trial must be 4 to 8 weeks. It's no good doing it for a couple of days. And the second thing is, even if after 4 weeks you're going, oh my Lord, my animal is so much better, this non-steroidal is absolutely fantastic, then brilliant, but that's not the end of the story. And we need to monitor that pain, and we need to add in analgesic medications which are synergistic to the non-steroidals as and when they become necessary. And it's a real ongoing process managing pain in a chronic.
And I think also the other thing that I learned from pretty much you is you've then got to look at unwinding the behavior. So that behavior might be quite cemented into their routine, and you're not going to just go, right, well, I've taken the pain, now be normal.
Yeah.
And I think a lot of people forget that. So part of your multidisciplinary team is the person, as you say, you call them your rehab team, and it's not just physical but also behavioural, emotional, is somebody helping you unwind the behaviour. Is really important, and it's a long time. I often say to people, this is a 6 month, 12-month project. You know, you're not.
Months, yeah. And I love what you just said then, Hannah, because what you just said was that you're unwinding the behaviour because it's become established. And remember, at the very beginning, I started talking by saying about the health triad. That we have emotional, physical, and cognitive health. And what you're talking about there is cognition. You're talking about the learned component of this behaviour. The fact that by the time we see this, there is some cognition involved, as well as emotion, as well as pain. And that's why this health triad is so important. And that's why those of us who work as vets in behavioural medicine put equal emphasis on physical, emotional, and cognitive health, because they are so inextricably linked. And like you say, yes, we can remove the pain, as in we can control it, we can give it adequate pain relief, and that's fantastic. And we can therefore help their emotional health, because pain is also an emotion. But we also then need to remember, like the German Shepherd I just talked about, who also had anxiety issues as well as pain. We've got to deal with that as well. So there may be more to the emotional health part of the picture. And then let's not forget the cognition, the learned.
Yeah. And I think taking it back to the first opinion world, and I've been in practice 20 years this year.
You whippersnapper young person, you.
No. But for me, it breaks my heart, the scenarios that we see quite regularly where we've got somewhere, you finally, the owner's on board, that behavioural change, that that compulsive behaviour is pain related. You get them onto the pain relief, you get them onto a long-term pain control, composition, and then they're unhappy because the behaviour is still there. And it's again expectation, because you lose that client because they don't feel that you've done your job properly, because they look at you having spent their money and seen them on multiple occasions and got them on multiple drugs, but it's not fixed.
Yeah.
And they go, well, you don't know what you're doing. And I sit there going, oh.
That's where the referral and the working together is so important. And Hannah, in these situations, that is where certified clinical behaviourists under the ASAB scheme, members of FABC, these are people who are so helpful to you as being colleagues who can work alongside you, because you've dealt with the physical health side of it. You've dealt with the emotional health side of it. You've thought about the fact this animal has emotional pain. If what you're left with is the cognition, then these other people are so helpful. The people who can use rehabilitation style training, that you can use ways of changing behavioural responses using learning theory. That's vitally important, and that's where multidisciplinary work between our professions is so important, and mutual respect, in which we talked about at the very beginning, is so important.
Yeah. No, totally. Well, because we're at 56 minutes, we need to answer another 2 questions.
Okay.
And we haven't done all of what I wanted to talk about, because I love listening to you. Right, Julie Butler, my 10-month-old collie sniffs so much on walks. She is anxious / aggressive. How can I tell if this is pain or anxiety driven on the walks? I have a referral to see you, but it's not for a month. And COVID.
And now it will be remote, I'm afraid, because of coronavirus. All our consults are still going ahead. We're still open. We're still taking referrals, but it is remote at the moment. It does mean actually that we can cover the whole of the country at the moment, because everything is being done remote. So if you want to refer from anywhere in the country at the moment, we can do it.
I will put your details underneath.
But we can't do, obviously, the follow-up after that. We will then have to find someone in your area to do the rehab afterwards, because if you're too far away, you won't be able to come for rehab with us. But certainly, yes, if you've got an appointment with us already, it will be going ahead, but remotely. So you said 11 months old or years?
10 months.
Okay. So we do need to be sensible, and we need to remember that common things occur commonly. And at 11 months of age, is chronic pain a likely diagnosis? It's not possible diagnosis. It's always possible. It could be a congenital abnormality that causes chronic pain. So absolutely, it can't be ruled out. But if this animal is sniffing a lot on walks, I think that was what you said, Hannah.
Yeah.
So gathering information, it sounds like on walks. You talked about being reactive, I think was the word that was used.
Anxious, aggressive.
Oh, aggressive. Okay. So what we need to know is what that means. Is that repulsion? Is that hostile behavior that appears to have a function of getting things or people or other dogs or whatever it is to move away, to increase distance and decrease interaction? Or is it confrontational? Because at that age, quite common in that age group to see confrontational behavior through frustration, because they're not very good at learning how to deal with their expectations in life. So unfortunately, this is a case that could be quite complicated, and I can't just give you an answer. But my thought process at the moment is, okay, we've got a young animal, so we think that although it's possible, here's Louis. So young animal decreases the probability of pain, but it doesn't rule it out. Anxiety is very likely to be involved here, and we want to know, is this a generalized anxiety? Does this happen? You're talking here on walks, I think, so we want to know the behavior like at home. Is this a behavior that is contextual to outdoors? Is it to do with environmental stimuli, auditory, visual, etc.? So we'll be looking at a lot of questions as to trying to pinpoint what's the trigger for that anxiety. And certainly we would be looking at gait. We'd be looking at movement. We'd be asking questions about that. We certainly wouldn't be ruling pain out. But I think we'd be also in this situation thinking about potential for anxiety and frustration being emotions that are involved in this behavioural change.
Okay. No, well, that's good, because that gives you the tools, Julie. You need to get some video clips.
Absolutely.
In the bag.
Yeah, and at the moment, because we're unfortunately remote, then yeah, the more videos you can supply prior to your appointment when it happens, the better, because we will be remotely coming to your house and doing it by video link into your house, so we can see your house and see your dog, and we can see the way your dog interacts with you. But obviously, anything that's additional to that is always useful.
I think COVID's going to have changed the vet profession forever.
Yeah, I think it's changed all of us forever.
So for followers, just a little tangent. For a good year to 2 years, there's been quite a hold on telemedicine because of where does it lead, prescription, diagnosing, all of these sorts of things have kept it at bay whilst the Royal Vet College really decides where we're going to go, because we are legally, obliged. We need to see the animal, we need to handle the animal, we have to be sure that what we're doing is as correct as possible. So doing something remotely and prescribing for a disease when you haven't touched, or it's very difficult. But because of the changing circumstances, that's kind of being pushed through temporarily because we need to work remotely. Changing world. Right, so Nick White, hi. Our 11-year-old collie has always been nervous, has tummy problems periodically, and has suddenly started being quite weak on her back legs. Ooh. I think she has lost muscle tone around her rump too. Could this all be connected? So he's talking about the physical. Yeah. So just run through what your brain's saying in that situation.
Like Louis. Yeah, absolutely, Nick. So the fact that you have tummy problems periodically, we know that there's a huge link between emotional health and gut stability. 75% of your serotonin, my serotonin, your dog's serotonin, is produced in the gut, and that means that you are highly reliant on your gut and your microbiome in order to have stable emotional health as well. So that's another live we can do.
Yes,
on the link between the microbiome and your gut function, your emotions. So yes, definitely. The fact that she has always been she. I'm not sure whether you said a he or a she. Doesn't matter. Anyway, your dog. She. The fact that she's always been nervous is relevant. The fact that she has tummy problems periodically is definitely relevant. And having weakness in her back legs, especially if you think there's some loss of muscle tone, I'm concerned about that. That needs to be looked at quite urgently, because she needs to have appropriate pain relief. Because what's important is she needs to keep moving, and that's what we didn't understand many years ago. I'm very old, as I said, and when I qualified, we really didn't understand this, and we used to think that being in pain was good because it stopped you moving, and that is absolutely not true. You need to get your dog moving well to build that muscle tone back up. You may need some physio and exercise as well to build some of that back end muscle up. But yes, these things are, I would say, undoubtedly linked.
Definitely interlinked. Good. And there is, I'll put a link from our website of a new download that we've got, which is the CAM factor. Okay. And so it's got the behaviour, posture, physical and capability change. And there's a little ... 3 opportunities to write the change that you've seen.
Oh, brilliant.
You can then take it to your vet and say, look, this is what I've seen. This is behavioural changes, postural changes, physical changes. I believe that there's something underlying this. Please, can we investigate it together? So I'll put that link down too. Believe it or not, I think you've just stumped everybody with how amazing you are, that we actually haven't got a huge amount of questions because people are just listening, which is great.
Okay. I
know that I really would like to, in future episodes, just play a lot further with just because, what am I trying to say? they will still do things even if it hurts. I really need to play there a lot because I hear it so much on our platform, firsthand at work, 19 years of being a vet, you know, family, friends, everything. And I just sit there wanting to scream. But we're going to do that in another one, if that's okay. Because I want to equip CAM followers with the confidence to have that conversation with family members, with friends. So when they want to say to people, actually, no, you will still do that, even if it hurts, they feel confident to do so. So we'll come back and do that next time because we're 65 minutes in.
Okay.
I'm not going to let you leave.
Do put the link to the practice. The other thing that we are able to offer as well is remote puppy advice, preventative advice as well. So if you're wanting help with, if you've got an animal you want to prevent behavioural problems, also please do get in touch with the practice. We can offer those as remote consultations as well at the moment, because of the fact that we are allowed to at the moment. What's going to happen after this, we don't know.
I'm just going to tell them very briefly about your place.
Okay.
I have to tell them because it is amazing.
Okay.
And that you've got this huge field with different subsections, so you can do a lot of observation, and they're safe, and you can watch them move. It's a fantastic place. So I will put the link.
You're very very welcome to make appointments to go there. Not at the moment. It is available for paddock hire for exercise, but nothing else at the moment. So yeah, and obviously you need to live within a reasonable distance of Chester to do that. But certainly, the website details will be given. You can find out more about the practice, and if you want to get in touch, then please do. Please phone the normal number. It's all on diverts to all my staff working in their houses, bless them, rather than in the office. But hey ho.
This way it goes. We need to do 10 top tips because we always do 10 top tips, and they're simple. They're applicable to anybody of any financial bracket, of any capability, with different age dogs, etc. Okay. So I'm going to start with number 10. It's always on my mind: weight control, weight control, weight control, weight control. I've just done another little webinar for Thursday, the VOA. And weight is such a big problem, guys. We have got a epidemic of obesity globally in our pets, to the point that we don't even know what normal looks like. But we know that weight is a massive negative input on managing an arthritic dog. So get a friend, get somebody that's going to be a bit harsh with you to tell you the truth. And you say to them, I can take it.
I need friends to do that for me, actually. But anyway.
Number 9 for you.
Oh, sorry, I'm doing this.
Number 9. You're okay. Number 9.
Cool. Number 9 is don't ignore the subtle stuff. So if your dog is hesitating to get into the car, even if it's just for a few moments, looks slightly reluctant, don't dismiss the small stuff. Yes, I think that's a good one.
For me, I would say is don't think it's the end of the road. Okay. I see this all the time where people come in with a dog that's say 11 or 12 and they're like, oh, well, he's coming to the end. It's the end of the road. And by the time we've got a management plan in place and we've got the right medication on board, different dog. So please don't think it is the end of the road. We can help. Number 7.
Okay. Don't hesitate to use trial medication to look for pain. So medication, analgesic trials of at least 4 to 8 weeks are definitely something worth considering. Don't think, oh, well, if we're not sure he's got pain, we shouldn't put him on drugs. Think about using it as a diagnostic tool.
Perfect. Number 6 for me is controversial. We have seen a massive influx of online supplement companies starting to target our followers. Algorithms and stuff that's way cleverer than we are. Please be careful, guys. A lot of the claims are just unbelievable. They're unbelievable. So if you're seeing anything with outrageous claims, managing arthritis, curing arthritis, dealing with joint pain, this dog went from this in 24 hours. No, be careful. Unregulated market, totally unregulated. Stay away. So that was my number, controversial number 6. Number 5.
Wow. Okay. Number 5, sticking on chronic pain. Chronic pain cannot be diagnosed in one consult in a consulting room, and obviously that's not relevant at the moment because you're not in consulting rooms. But but think about an ongoing process. Pain management, pain diagnosis is an ongoing process. It's not going to be a one-stop shop. It's going to be an ongoing process of investigation.
Yeah. Number 4 for me, having spoken a lot about emotions, behavioral responses, you can start to understand there's a lot more subtlety about this disease. I'm hoping that will promote the little things that people think are cherry on the cake into a more prominent position. The engaging games, the time spent together, the scenting, the going out for walks, the new visuals, the new experiences. Oh my God, they're free of charge and they make such a big difference. And I hope now you can understand what role that they can have. They're part of the plan. Okay, number 3.
Number 3 would be, remember that an animal in pain may become more what looks friendly, what looks happy, what looks engaging, because appeasement can also be shown when you're in pain. So seeking information from those around you, especially those who care for you and those who you rely on and you trust, it's very likely that when you're in pain, you'll look for more information from them. And therefore, remember that could be also a sign of pain.
Yeah. Number 2 for me, I've said this a number of times, is let's talk about this. So you might be benefiting from the CAM advice now, and great. But just imagine if you'd had that advice 2 years ago, 3 years ago, and imagine where you could be. There are going to be people out there that are just about to start their journey with your help. So let's talk about this, the whole topic, be it the behavioural side, be it the pharmaceutical side, be it whatever it might be. But can we please start talking about chronic pain and specifically arthritis, so that you can help other people start their journey earlier, so that we can make more of a difference. Number 1.
Okay, so number 1 for me is remember that health is a triad, that there are 3 equal components to our health, to the health of our non-human companions as well. And that is that we have physical health, we have emotional health, and we have cognitive health. And the 3 are equally important and inextricably linked with each other.
Amazing. Oh, I love you.
I love you too.
I've so enjoyed this evening. So I'm hoping that everybody will have had a great time, that they're going to say, please come back, Sarah, because you are so busy. You're all around the world. You're on self-isolation at the moment.
I'm not around the world at the moment.
No, you're at home with all your cats.
At the moment, because I was in Botswana when this all happened.
Botswana?
I was in Botswana and I was completely out of phone and email and everything contact. I had no contact with the outside world. So I went into that situation on the 4th of March, and therefore when I came out on Wednesday and my phone started going berserk, I went, oh my God, what is this about? And I was still in Botswana, and then had the concept of, and how do I get home?
Oh my God.
So I got home late Friday night to a world that I did not recognise.
No. It is like Shaun of the Dead, isn't it?
I left before it happened, and I came back to total, like, what on earth? So I've still in a bit of a state of shock, really. I've been dealing with the practice and everything since I got back. So so it's been nice to have a chat about behaviour. It's been lovely. I've really enjoyed it. I
love it. And if you've ever got any free time, I will switch on the laptop and we'll do a Facebook Live and we'll just chat about stuff, because I honestly believe that one of the biggest hindrances to us managing chronic pain better is behaviour. I think that if we can get not only the profession but also the public to understand behaviour, then we're going to be identifying this disease earlier, and
Yeah.
we're going to have more interventions
I
available.
really agree.
Many of them won't cost, and I think that's a big problem, is that the public are in fear of going to the vet for the ongoing costs. But if we catch it earlier, many of the interventions don't cost anything, so everybody's a winner. Yes, so let's talk about behaviour more.
I'm up for that. Okay. Thanks
All
so
right,
much,
see you
Hannah.
later.
Yeah, bye for now. Bye, everyone. Bye.